Hey everyone, so guess what? It is week 30 of the pregnancy. 30 weeks.
Wait, that's a 5. 30.
30. I'm not that I ever second guessed that we'd ever get here, but to be at 30 weeks, the doctors are probably crapping their pants a little bit.
Yeah.
Everybody's probably crapping their pants a little bit.
Yes.
So we're really excited that we made it to 30 weeks. Obviously, we plan on going for much longer at this point.
Yeah.
I'm not having any of the symptoms or signs that things are going to be changing. I don't think that they think anything's going to be changing.
Right.
If anything, now that the longer we've been here, things have gotten better, I feel like they're not telling us their expectations are different, but I think that they're expecting more good than what they're saying just by some of the orders that they're putting in for me.
Right.
And we'll talk a little bit about that.
Right.
But we're very excited that we've made it this far.
Yes.
One of the questions that we're getting a lot is that because we're doing a countdown, like if you follow us on Instagram, I've shared the countdown as far as how much longer we have to be here. And the goal has always been, since we've checked in, it's always been 34 weeks that they want to get us to 34 weeks. I think that that's just a goal that they have in mind because that's the best case scenario for a baby. It's better for them to come out at 34 weeks than to stay in if there's any high risks going on.
Chance of infection.
Yeah, like chance of infection or if it's a high risk pregnancy, they just want to get the baby out at that point if they can.
Yeah.
So that's always been the goal, and so my countdown has always been to 34 weeks, which it's good to have a countdown and it's good to have a goal, which is nice, and it's nice for me because I look at the countdown and I say, okay, like today, 28 more days until 34 weeks. That's 28 more days until I'm off bed rest.
Yeah.
That's for me. But at 34 weeks, that still means that he's a preemie baby. So that's ideally not a goal for any pregnant woman, but for this situation, that has been the goal. I've had people say, well, if you're still doing good at that point, will the doctors let you go longer? I don't know. They won't discuss it with us. The last time I brought it up, they said, well, basically they don't think you'll make it to 34 weeks, so they just don't even want to talk about it. They really take things one day at a time, 1 week at a time, and they don't want to discuss anything further past the point that you're at. But I honestly believe if we're still doing really good, even if I have to tell them, can we monitor him more, or even if I have to do like 24-hour monitoring, which I would despise. But if that meant that we could check on him and he could stay in there longer, and it meant that, it would be better for him, then I would do it.
Yeah. So
I really think that maybe they would let me go a couple weeks longer, but I honestly don't think that they would probably let me go past 37 for sure. That's just my guess, but we'll keep you guys in tune with what's going on.
Yeah.
I don't think that they'll probably talk to us till we're much closer to 34 weeks, like maybe 33 weeks and 5 days probably.
Right.
They won't talk to us about it at all. So that is the plan so far. Obviously, with the countdown, that's more so for me, not really for him. We'd like to carry him full term at this point. If things keep increasing and getting better, then I don't see why that wouldn't be an option. Right. That's what we've been praying for this whole entire time. Not that we've given up hope that things would change, but it's like there's been slow victories along the way, which is awesome and fine.
Yeah.
But it's like I said, oh no, I just skipped up. I don't want you to have to edit.
I won't edit. It's fine. I don't have to edit.
I want you to have to edit.
I'm not going to.
I'm losing my mind a little bit. I feel like the further along we go too, like my memory gets shot. The further along we've got, like doctors think like the further along we get, the worse things will start to look. But we've kind of seen the reverse of that, which is the goodness of God, is that I wanted to see like a big victory right away. I wanted to see when we went into the sonogram that there'd be like 5 to 10 centimeters of fluid. And,
do you need to breathe?
Yeah.
Breathe.
I'm so out of breath.
You're starting to get like this late night hotline voice going because you weren't breathing.
I was trying to
just force everything out without
20
breathing.
minutes long.
It's okay. Are you guys okay with 20-minute videos? Some of you are, and some of you are definitely not okay with it. That's okay.
So anyways, I'm getting lightheaded. I expected to see like a big victory right away, and then I feel like over this last like 2 weeks since our last update, we've seen things shift in our direction for the better.
Yeah.
So do you want to talk about that a little bit so I can catch my breath?
So
talk about the monitoring, how they changed it the first time and then they just did again.
Okay, so over the last 2 weeks since the last update, the last update I believe was when you started to reduce monitoring. I think we first mentioned that the last time.
I don't
anyway,
think
2 weeks ago.
Had yet.
Okay.
I just started like a week ago.
Okay. Well, 2 weeks ago, the monitoring went from, instead of twice a day for 30-minute sessions, which is the minimum usually, to once a day. And then this last week on Friday...
Because he was doing, they thought, well, he's been doing well, he seems happy.
He's doing well, no worries.
There's no reason to do too.
They also backed off on doing her vitals. They were doing every 4 hours.
We did share that.
We did.
We did share that.
Okay. And so, basically, a week ago, is when they decided to do monitoring once a day. And now, as of this last Friday, he did a biophysical profile and he passed it. They said it's normal. His fluid level was a 2, which is the first time it's been that way since we've been checking it, which is phenomenal.
Yeah, I'll explain for those of you who don't know what a BPP is, or a biophysical profile, is basically what they do is on the sonogram, there's 3 different things that they look at. They're looking at to see if he's practicing breathing, so they'll see if his diaphragm and everything's moving.
Yeah.
They want to see 3 movements, like 3
significant
movements. And then they want to see at least 2 centimeters of fluid, and they need to see all of that within a 30-minute sonogram.
Yeah.
And the first biophysical profile we did was at 28 weeks, and he passed the first 2 things with breathing and the movements within less than 10 minutes. And the sonographer was like really impressed with that, because she was prepping us like, it's okay if he doesn't do it for a while, and literally put the wand on him, and she's like, whoa, he's like already breathing. Saw like he's always been a wiggle worm, so she wasn't really surprised about that. But then the first BPP we had, he still had less than 2 centimeters of fluid, so we didn't 100% pass that one.
Right.
So then just on Friday we did it again, and for the first time ever we've seen 2 centimeters of fluid. It was like 2 centimeters exactly. But that meant he passed. So they were very happy about that. And then
so now they're going to monitor twice a week. So Mondays, Wednesdays, and then Fridays are our weekly sonogram. So they're kind of getting a little bit of a monitoring in at that time. So we've had side note, a little bit of confusion with the doctors, because apparently somebody forgot to note that we were supposed to do that.
Yeah,
on
there's
Friday.
Some miscommunication that likes to happen around here, especially if you have a resident changing rotations, or the weekend happens and you get weekend doctors in. It's kind of frustrating. But we've been in here for so long that we kind of see those things. People who are here for like a few days or like a week or 2, they might not catch that stuff, but since we've been here, we've kind of seen that stuff. So we've kind of learned to roll with punches a little bit, but it is kind of frustrating, especially when you're excited and you're like, oh my gosh, 2 monitorings a week. But I'll be honest, like I'm not like too mad that I had to do monitoring yesterday and today at least once, because I think just with the situation, it makes me feel a little bit calmer and
have some peace of mind about it.
I mean, less nervous just to hear his heartbeat, and that everything's fine. And plus, like the last not today, but what's today? Today's Sunday, so Friday and Saturday I'd still feel him move, but he was pretty quiet in there, not as much movement. But I've actually noticed, like, for a long time, I don't know why I still get nervous about it, but I think when he goes through some growth spurt activity, he'll be like really active for a couple days, and then for a couple days he'll be a lot calmer in there. And so I think that he's just going through a growth spurt, and so that's what I believe happened. Because today he was much more active. Last night for the first time ever, so he woke me up in the middle of the night from his movements, which like I said, it's the first time ever. Normally when I wake up, if I think about it, then I'll feel him, but it's not been where he wakes me up out of my sleep, and
Right.
it was like where he was pushing out like so hard against my stomach, and it wasn't comfortable. But I mean, that's a good sign, right? That he's that these different things are happening. It means that he's growing, that he's active. Like I've said before in the videos, if he's moving, then he's a happy baby.
Right.
And even the resident was like, well, he seems like a happy baby on the monitor on his with his heart rate, that he's moving and he's active and he's getting his accelerations in. So he's doing really, really well. The thing that Derek had to tell me because my mind just veers off in this direction a little bit is I am a positive person, but I also try to just remain like pretty, what do you call it, like just even, like what did you say, and
level.
just try to stay like level-headed and not get like too excited or too low. So when the good report with the BPP happened, I was like, Derek was like praising God and like crying and very happy about it, and of course I was happy too, but at the same time, like, it's probably just a little bit of the enemy voice too. It's like, well, don't get too excited, like if anything it could change like that, just like the doctors constantly say, like, oh well, you feel good now, but it could change in 5 minutes, you could be bleeding or cramping or whatever. And so just a little bit of that came in, but Derek was like, no, he's like, we're taking ground, we're advancing, and we're not going backwards. And I'm like, yeah, dang it, that's right. Like, if we get a good report, then we're standing on that, and we're not going backwards, and I'm not looking at the what ifs, and if we have good things happening, like monitoring's getting changed, my vitals are getting changed, if anything tries to come in and interrupt that and basically take us backwards to make things look more negative, or, like, I don't want to be nervous that when we go in next Friday for the BPP that he doesn't pass or the fluid's different. I want to be like, no, I'm expecting even more, because we're continuing to advance. Like, that's what the kingdom of God is. Like, that we continue to advance, and even if it's small victories along the way, even when the doctors are expecting things to get worse, we're expecting them to get better, and better and better and better, and we're not going backwards. I'm expecting to make it to 34 weeks. I'm expecting to make it as long as they let me go. I'm expecting to deliver in the way that I want to deliver, and I'm not expecting anything bad. I'm not expecting anything bad to happen. So thank you everybody for your prayers, for fighting for us. Sometimes I'm like, I think people are probably praying more than we're praying, because I'm just learning to like rest in the Lord and just and be dependent upon him, and just put everything in his hands, and not be in constant like warrior spiritual warfare mode all the time, because I can't, like, that's not the season that I'm in right now. I can't really be like super warfare chick, but I think that people are praying harder for us, but continue to, even though we're seeing ground being taken, that don't back down in your guys' prayers, because we really, really need them, and we want to see this fluid continue to increase. They don't know, like, okay, what does this mean if your fluid's increasing? Does it mean that he's now blocking whatever leak that you have in your amniotic sac? Does this mean that your sac's sealed up, supernaturally or whatever? It could mean that. I'm going to be blatantly honest. I know that I'm still leaking fluid, but we can continue to still pray that does seal up, or if he was blocking anything, that he stays in that position to continue to keep that hole or tear or whatever. We have no idea how big that is in my sac, that whatever's leaking, we don't know how big that is, so that he continues to cover that. Whatever needs to happen, I don't even care if it is physically, maybe everything is all supernatural, and it's just going to continue to increase. Just continue to pray for that. The further along we get to, the more kind of nervous I get, because it just becomes more of a reality that he's going to be coming out at some point. Like, this, just in any pregnancy, like, he's not going to stay in there forever. So I do start, the closer that we get and the more that I see the countdown, I'm like, oh dear Lord, like, this boy's eventually going to be coming out. Maybe C-section, maybe vaginally. I don't know, but it does make me a little bit nervous. But as we get closer, it'll be okay. It'll be okay.
Yeah. We've just been doing this for so
Very
long. Like,
fun.
it's just been the day. It's just been what our life has been for,
Like to wait. Like to
we
wait.
7 weeks when probably most of you see this video and you're like, you don't feel like it's going to end.
Yeah.
Like, is this ever going to end? Is it ever going to stop? And, and then, they're taking back, they're doing less things because they're confident. And then you're like, okay, but then...
Then you're like, why am I here? Can I go home?
Yeah.
But you can't go home.
Right. And then as time goes, then we know that probably the monitoring will increase at some point because we're getting more to that time and that crucial time, that 34-week period or beyond or whatever they let us do. And so you're just like in this, people always ask, how you guys doing? How you feeling? What's going on? It's like, well, we're kind of just here. That's what I feel like. Like, we're just here. We're just doing it. I think a lot of you praying for us is giving us strength beyond what we even realize or what we can do on our own.
Yeah.
And so, hopefully you can't hear those people talking and laughing in the hallway right now.
It's so loud right here sometimes, this hallway.
But hey, you got a lot of space. You got to sometimes sacrifice a little bit. So, but we are doing really good, and Sabrina is doing so good. And she has her moments where she breaks down a little bit, but I'm like, dude, you're pregnant. You're crying for no reason when we weren't here. So,
Wow.
there's like less things that, like, now I feel like you're more emotionally stable than you were even before.
Probably. I mean, mainly I feel like my breakdowns are just like thinking like, oh God.
What am I going to eat tonight?
That's been one of our biggest predicaments. No, I don't know what I think of when I think it's just me being tired of being here. Or I wake up and I'm like, I'm such a planner person and I want to do stuff and I'm literally like, should I write out a schedule of what I'm going to do while I lay here all day? 10 to 11, I will eat. 11 to 12, I will monitor. 12 to 1, I will take a shower. Like, I feel like I need to do that.
Put an asterisk.
Do some sort of like...
Pee every 45 minutes?
Yeah.
That's a hashtag, not an asterisk. Can you make an asterisk with your hand?
Like a hashtag? Oh,
no,
an asterisk.
An asterisk. Help me. One more finger. Asterisk.
You're stupid. Why do you do stuff like that? You're weird.
Why are you getting embarrassed?
I'm not embarrassed. You're just weird.
Why are you turning red?
I don't know.
I'm embarrassing you?
No, I'm getting tired now.
It's okay.
I feel like this video is like 25 minutes
No,
long.
we're going to end this right now. That's really it.
Yes.
So we will...
I've been doing better, like emotionally,
Yeah.
more stable. I think
Yeah.
over the last like week or and a half.
Can you
or
let me just
whatever.
finish this up? We can wrap this up. I already kind of said that. We talked about that.
No, you said that I would that.
You just kicked this. Hey, if it's shaking, it's because she just kicked it. You are doing a lot better. That's what I'm saying. You're doing really good.
Thank you.
Yeah. So, we're going to update you guys again in a week with a video because next Friday, May 12th, we do updated measurements. Oh, we didn't mention this. On the last sonogram,
Excuse me.
when they first started it, I noticed, I was like, he looks bigger. And then the sonographer, she goes, he looks a lot bigger. And I was like, yes, because I had thought it, I didn't say it to her. And she's like, I was like, that's exactly what I thought when you first put that on there. We've seen so many at this point. There was a significant difference in his size, it seemed.
Yeah, I thought so.
Yeah, and so we'll have official measurement updates this next Friday. So we'll put a video out next weekend to update you guys. 31-week / growth update.
We would love to see him over 3 pounds.
Yes, over 3 pounds. Be
So-
praying for that. But we appreciate all the prayers and the fighting, and we're figuring out this Instagram thing. So get on there, follow us. Holy
yeah,
Schwint.
because I do a lot more things on there, like daily stuff.
Yeah.
Video, like the stories.
If you
and
really want to stay
videos.
connected,
Like if you want to see like how Derek clipped my toenails for me.
I don't know if you'll catch that because that story is probably past.
They
you
were
can see
getting
this.
so long.
They were long.
Dude.
They were long.
I didn't want to have to ask him to do them, but.
She wouldn't ask me. I'm just like, finally, I was like, dude, this needs to be done. This is bad.
Oh, there's a lot of things that need to be done to myself.
Yeah.
Lord. Like, firming up.
You can't firm up yet. You gotta wait till the baby comes out. Gotta wait till True's born, and then you
Oh
can't.
my god, it's horrible.
So, but we really thank you guys for joining us on this journey, for following us. allowing our story to be encouragement to some of you. She's been connected with people from all across the country, really in the world, even reaching out and saying the story is encouraging and you're helping me and those types of things. So that's really great, because we just want this, even though this has been a trial for us, we want this to be something that can encourage you and others that may be going through the same situation, that you can know that you can win this fight. Don't just quit. Don't give in to what the doctors say, because they're going to give you the worst case scenario every time. But fight for life.
Yeah.
And that's what we've done. That's who we are. That's who we are as people. That's who God is. And we fight for life. And we have a great community of people that fight for life too.
Yeah, and it's like, even you think 1 week, like, oh, like, we're not going to see the changes that we want to see. And then from 1 week to literally 7 days, to 7 days later,
yeah,
you see the change that you want to see. And it's
right.
like, you can't give up at any point along
No.
the path or along
You
this journey, because it could change like that.
Yes.
Like, for the better.
People are resilient, and babies are even more resilient.
Oh, they're so smart.
They find a way. It's a miracle of life.
They're so smart.
And they'll fight.
Yeah.
They'll fight too, just like you're fighting for them.
Yeah.
So.
Yes. All right, that was our week 29, 30 week update. We'll get another video out hopefully within the next 7 days, so we can give you guys the measurements.
We will get it out in the next 7 days.
Yeah, we will.
We will.
Yep.
All right.
Okay. Love you guys. Thank you so much for watching and staying in connection with us. Go like us on Instagram. It's at Holy Schwint. We will put it down in the description box for you guys if you don't follow us already. And then we will talk to you soon.
All right.
Love you. Bye. Gotta be.